Sydney, it's time for a checkup. Your postcode says a lot about your risk factors, what ails you, and even what you're more likely to die from. When it comes to health, Sydney is a tale of two cities, with gaping inequalities that are intrinsically linked to wealth. People living in some of Sydney's poorest southwest suburbs are significantly more likely to die avoidable deaths at much younger ages than people in affluent northeastern suburbs. In Campbelltown, people die on average 13 years earlier than people living in Hunters Hill, 75 compared to 88 years old. When it comes to obesity, a thick band of red and orange carves its way around Sydney's western suburbs, like a waist belt. Camden is Sydney's obesity capital, where 1 in 3 adults are overweight or obese. Over in the east, suburbs that hug the coast and harbour have dramatically lower rates of obese and overweight people. In Ku-ring-gai, Sydney's slimmest area, fewer than 1 in 6 people are overweight or obese. It's a similar story for kids. More than 1/3 of children in Mount Druitt and Wayland are obese or overweight, closely followed by Canley Vale, Ashcroft, Lakemba, Punchbowl and Liverpool. Meanwhile, Mossman, one of Sydney's richest postcodes, has the lowest rate of overweight and obese kids in the city, followed by Ku-ring-gai, North Sydney and Woollahra. The obesity rates in the southwest are a big reason why chronic diseases, including heart disease and diabetes, are much more common than in the east. It makes sense. Western Sydney suburbs are some of the least active in the city, with less public transport and green space than their eastern neighbours, and more time spent sitting in cars and traffic-clogged motorways. There's also a higher concentration of fast food chains, and people eat less fruit in the west. These areas also have a higher concentration of people whose ethnicity and genetics make them more predisposed to a range of chronic conditions, and whose non-English speaking backgrounds make it harder for them to access health services. People in the West are also more likely to die of potentially avoidable cancers. Mount Druitt residents were 2.8 times more likely to die of cancer than people in Gordon. Lung cancer among men is far more prevalent in Sydney's West, where people are more likely to smoke. But it's not all good news for the coastal elite. The eastern suburbs on average has higher rates of risky drinking. 1 in 4 people in Mossman drink alcohol at levels that risk their health. High rates of melanoma spread up and down the coastline's wealthy suburbs, with their easy access to sunbathing on the beach and a higher concentration of people with fair skin. And breast cancer is significantly more common in the more affluent northeastern suburbs like Lane Cove, Mossman and Willoughby. Experts say this is because one of the biggest risk factors for breast cancer is longer, uninterrupted estrogen exposure, which is much more likely in affluent Caucasian women. Prostate cancers were also more common in the east, but that's because men in these suburbs are more likely to get diagnosed. Our health is not just a matter of willpower and self-control. Where we live, our social status, genetics and environment determine how healthy we are. It's up to our healthcare, social services, housing, urban planning, and even transport system to help Sydneysiders live the healthiest lives possible.